This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And at Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain.
So, Dr. Sugata, our topic today is on retinal diseases.
Morning, all of a sudden I start seeing less.
Open.
What is retinal disease? I am Dr. Khawla, and in today's episode, we will discuss a subtype of eye diseases that causes severe visual impairment or even blindness if left untreated.
Come in, please. Hello, good morning. How are you doing today?
I'm good.
Okay, the nurse tells me that you were seeing less from today morning. What happened?
Yeah, this morning all of a sudden I start seeing less.
Okay.
From my right eye. It's like blurry.
Okay. Are you diabetic?
Yes.
Okay. So the lights, please. Yeah. Thank you. I'll just take the chair back. Can you remove your glasses? I'll take the chair back. Go back with the chair. Okay. Okay. Look up. Okay, that's fine. Can you look down? Okay, towards me. Okay. Same thing. Look up. You good? Can you look that side? Look down. Towards me. Okay. Yeah. Can you start the lights? Thank you. See, you have developed a retinal detachment. You would have to go through surgery. What has happened is basically this retina behind has detached. So we will have to take you up for surgery and then reattach it. So we'll have to remove the jelly and we'll put it back. So surgery would be required for your right eye. I also noticed that you also have diabetes, which may not be well controlled. So that is why we might have to do a little laser in that eye to stabilize your blood vessels. Okay. And yes, we'll have to send you to the physician to get your sugars controlled. Right?
Sure.
Yeah. Okay, come.
Hi sir, good morning.
Hi, good morning.
Please come. Have a seat here. What's your good name?
Mohan.
Second name?
Mohan Maharjan.
Yes sir, it's for routine checkup or you have any issue with your eyes?
No, this morning all of a sudden I start seeing blurry from my right eyes.
Right eye?
Yeah. From this morning.
Morning, what time?
It's like when I get up from that time around 7:30.
How suddenly you feel?
Yeah, suddenly I feel that I cannot see properly from my right eyes.
Okay. Do you have any other medical history? Diabetic, hypertensive?
I have a diabetic. I'm
Diabetic.
diabetic, yes.
How many years?
It's like recently, 6 or 9, from 9 months.
Taking any medication for that?
Yes.
He's our optometrist. He will going to check your vision.
Hi sir, good morning.
Good morning.
First let me check your vision. Can you take off your eyeglass please? Okay, you can just see the board. Can you read from this?
Oh, no, it's blurry.
First line is blurred, right?
Yes.
Can you see, count my finger?
I can see something, but it's like
Okay.
blurry. Yes.
Can you see now? Can you see the movement?
Yeah, only the.
Okay, only the hand movement, right? Okay. Then for the left eye, can you read?
Yes.
Okay, just read.
First line I can read A-R-E.
Okay.
Second round is P-O-Z.
Now
No, it's blurry.
it's blurry now.
Yes.
Okay. Let me check the eye pressure also. We'll check your eye pressure. Please put your chin here. Keep your head close. Okay. You can see one red light inside. Just focus on that one. This with a small air puff. Okay. Please look straight. For the left eye. Please wait there. So doctor will see now inside. Okay.
Thank you.
Did you know that there are several risk factors to getting retinal disease? These include high blood pressure, high blood sugar, high cholesterol, smoking, or even excess exposure to ultraviolet light. To find out more about retinal disease, I'm about to meet with Dr. Swagata.
Come in.
Hello.
How are you doing?
Good. How are you, Dr.
I'm good.
Swagata?
I'm good.
Thanks for having us today.
Yes.
So, Dr. Swagata, our topic today is on retinal diseases.
Yes.
So, what can you tell us about retinal disease?
See, retina as such, this is the light sensitive layer of the eye. So let's say if this is like a camera system, we have the cornea, the lens, the gel, and the retina. So what this does, retina, is like a film of a camera. So all that we see is basically projected onto the retina, the neurosensory layers. From there it goes to the nerve, which carries it to the brain, and the brain basically recognizes what we are seeing. The retina basically receives the light, and then there is a blood supply layer which is called as the choroid. It's below the retina. Now all the cells, they form the nerve, and from the nerve it goes to the brain, so we recognize what we are seeing. Diseases of the retina can be multiple. It is basically the most common what we encounter in retinal practice is retinal detachments. That is basically what happens with aging. This is the jelly of the eye.
Yes.
The jelly starts degenerating. It's a normal aging process.
Like shrinking, you mean?
Yes. So because what happens is basically when the gel starts shrinking, it starts pulling on to the retina.
Starts to pull the retina towards it.
Yes, and what happens is if the pull on the retina is a bit too high, then what happens is we develop tears, and from there the retina starts detaching. So when the neurosensory retina starts detaching, the first thing the patient says is there's painless, sudden onset diminution of vision. So they basically come in emergency and they say that they were seeing well. All of a sudden they felt that they could only see half, and they were not sure as to what it is.
Okay, so it's sudden.
It's sudden.
Is there a way to predict it?
There usually most patients, some patients are more predisposed to having retinal detachments, especially if they have a family history of retinal detachments. Some patients like diabetics, okay, they are also more prone to having a different form of retinal detachment, which is called tractional retinal detachment. So in them, the retina, basically the diabetes causes fibrous bands, and the fibrous bands start shrinking. So they pull 2 points in the retina and just tear it off.
Okay.
So
it's like clothes shrinking, essentially.
yes, it's basically like you have two layers of clothes where it's shrinking and one is pulling onto the other. So sometimes if it just the vitreous detaches, so it doesn't cause any harm to the retina.
So Dr. Swagata, what are other causes for retinal detachment?
Causes are basically multifactorial. They could be because of age, they could be because of diabetes, diseases like diabetes. But what we see most commonly in retina practice is either because of aging, the jelly basically starts detaching from the retina, and during that process it pulls on the retina, causing it to tear and detach. This is called as retinal detachment, rhegmatogenous retinal detachment. In diabetics also we encounter retinal detachments, but they are a little more complex, in which because of the disease progressing, there are fibrous bands which develop across the retina and then they shrink, causing the retina to detach because of the traction on the retina.
I see. So there are local areas of, sort of fibrous tissue
Yes.
causing the retina to snap
out. So they have localized areas, but it's mainly tractional in diabetes. Whereas in elderly age groups, it's mainly because the retina develops a tear and therefore the retina detaches.
Okay. So how do we diagnose retinal detachment?
Usually the patient, when they come in, they complain of sudden onset loss of vision, or we ask them a history of diabetes, hypertension, so from there, and whether the sugar is well controlled or not. If the sugar is not well controlled, or we want to decide on how to go forward, the first thing that we usually do is we dilate the pupil and examine the retina.
And how do you dilate the pupil?
We put eye drops. Okay, we put eye drops. The patient basically needs to keep the eye closed for about 10 to 15 minutes, and the pupil just enlarges, which gives us a better view of the retina.
Okay.
And we use a machine called as an indirect ophthalmoscope. Sometimes in patients, especially in diabetics or even in senile retinal detachments, if a blood vessel ruptures at the time when the retina is detaching, this cavity is filled with blood. So in those cases, we are not able to see the retina. We usually send the patient for ultrasound of the eye, B-scan of the eye, which helps to determine the status of the retina behind the bleed.
Is it a serious condition?
Yes, exactly. To know whether it is a serious condition or whether the patient can just wait and watch till the blood clears, that is exactly the reason why we do a B-scan. The B-scan would basically help us to determine whether the retina is still attached behind the blood. So if it is attached, we just tell the patient, rest assured, give it some time. We repeat the USG every 2 weeks. If the blood clears and the retina is fine, we don't intervene. But if there is a detachment behind the blood, we immediately need to take the patient to surgery.
Very good. Can you show us some of the machines that you use, Dr.
Yes,
Swagata?
yeah, we'll move on to that.
Okay, very good.
This is basically a fundus camera. It takes a photo of the retina, just like we take a photo of a person. It takes the photo of the retina and it helps us to see the back of the retina. Sometimes in diabetes, okay, if we need to see a cross section, it's the same machine. It behaves like an OCT, so we can see. I'll show you. Like this patient that we saw in the morning today, his right eye, you see this fuzzy area?
This is the right eye,
yes,
right? Okay.
yeah. So from the nerve, this is a picture of the nerve that we can see. We can see the lower part of the retina is attached.
Yes.
Yeah, so the upper part is not very clear. It's appearing blurred. Now that is basically the detached retina. So he would require surgery to fix the retina back in place. We'll also see his left eye.
So this gives us a zoomed in view.
Yes,
of
so basically it gives us a much clearer view of what we are trying to see. So I'll show it to you just like, okay, so now, so this is basically the left eye of the patient. So,
Okay.
You see all these blood vessels, they are all leaking blood. The yellow that we see is basically oil, that is lipids. So this retina is badly affected by diabetes.
I see.
So what we see basically is within these areas, this is called as the macula. This is a very important area that we use to read, to see things for near.
Okay.
So because diabetes has affected this area with so much of leaking blood vessels, what is happening is when we see the cross section, let's say when we've taken a cross section,
Yes.
this is how it is. You see
Looking
this?
at the thickness
Yes.
itself.
So this is more like normal. It's not so spongy.
Okay.
What we see here is there's
dear.
a lot of fluid accumulation.
Yeah.
So we see that it's now increased in height, and
Black,
that is
black
yes,
is fluid.
black is fluid. So because this black is fluid, it is basically not, the patient is not able to see clearly. So for this eye, we need to do laser to get to block the leaking blood vessels, and we sometimes also give injections which basically help to reduce the fluid accumulation in the retina.
Okay.
So once we give him the injection, yes, maybe his retina will come back to normal.
Okay, very
Yeah.
good, very
Let
good.
me show you. I'll be doing the laser on him. Okay.
Fantastic.
Yeah. Come. Yeah. So, yeah, come.
Hello, sir. Good to see you.
Yeah, so we'll be treating him with laser. Okay, come. So we set the laser power. Okay.
Okay.
And this is the duration for which we want the laser, and this is the power.
So it's really just a clinic procedure.
Yes,
Okay.
it's a very clinic procedure where we just dilate the pupil, and like the photo I showed you, and thereafter we treat off those leaking blood vessels. Yeah, come.
No need to go into a theater. and
No.
get-
This is an OPD procedure. The patient comes in and is treated on the same day and can go back and just resume his normal duties.
Okay.
Yeah, come. Look straight. Very good. Want you to look straight. Open. Very good. So once we have a view of the retina, that's it. So we start the treatment. Right. Yeah. Now don't move your eyes. Look straight. Very good. Okay. Very good. Very good. Okay. It's very nice. Don't move. Yeah. So excellent. You can blink. Very good. Yes. Yeah. Are you getting any pain? No. Okay. Very good. Just we are done. We just need to treat. Excellent. Yeah.
Quick.
Okay. Yeah. It's just the few blood vessels that is there. We just treat them off. We seal it off so that he is better able to see much clearer. This laser that I did today will take its effect over the next 3 weeks. So he should be getting better. Yeah.
Okay.
And you'll also have to take control of your sugar. Yeah.
Sure.
Yeah. Okay. Yeah. Come. Take care.
Very good.
I'm Dr. Sarkar. I am basically a consultant ophthalmologist and a vitreoretinal surgeon at Bahrain Specialist Hospital. I have been in practice since the last 20 years and have completed more than 54,000 surgeries. For Bahrain, what I notice is diabetes seems to be pretty highly prevalent in the population. Many of them are really scared about surgery because their understanding of retinal diseases is that it's a very complex procedure. Actually speaking, as we saw, it's a very easy procedure with time, our instrumentations have changed. So today it is more like laparoscopic surgery of the eye. The patient comes in the morning and we do the surgery, and by evening he's actually ready to go.
For me, it was everything's clear before the, my, what do you call that, start seeing blurry. And it's very important day-to-day life that you need to see things clear. And I'm working in a hotel industry, and I have like computer job and all. So whenever I see in the computer, it's too blurry. It's hard for me to look at the computer and do something. So it was really, really difficult. And then once I have done that my surgery, so now I can see clearly. So it's very important. After the surgery, I can see things clear. So once if you see clear, definitely you will feel better. So it's helped me with my day-to-day life, and when I go to work also it's helped me in my work life. It's really very, very, very good and very nice.
The eyes are the window to the world, so they should be a little bit more alert. So if they find that their sugar levels are fluctuating with time, it's always a good idea to come and get themselves checked. Maybe there'll be nothing, but that is good. It gives you peace of mind. Yes, okay, my sugar is varying a little bit, but yeah, we just need to monitor it. This is more important for people who also have hypertension along with diabetes.
I like to thank Dr. Saugata Sarkar, for his help. I can say his help. Because of him, I can see things clear now.
Every week at Health Hub, we bring you the latest and most relevant information to your health. I'm Dr. Khawla. Stay safe.